went to America for Christmas and New Year. I wanted to have a white Christmas, and so day 5 in New York I came down with the flu pretty bad. There was a musical and a play that we were supposed to go and see on that day, and I was just too sick.
Certainly there have been patients in past years in Monash Health who have died as a result of the flu. I get particularly worried about our elderly patients, our immunosuppressed patients, and some of the patients with other comorbid conditions who are more susceptible to flu.
And what we don't want is for any of our staff to get sick, especially while they're here at work. But even more importantly, we don't want any of our staff to actually make others sick or to feel that responsibility of other people catching influenza from them. Influenza is something that can be prevented, and we take our responsibility in prevention of influenza incredibly seriously.
It is important just bringing your young girl or boy into the hospital knowing that everyone is basically clean and allergy and flu free.
There was a very well documented case in the United States of a transplant patient who was immunosuppressed, who was therefore more prone to catching the flu, flu from staff, a documented transmission. The patient got a severe bout of flu and died, and of course the family weren't very happy with the staff. And of course the other thing about the spread of the flu virus is that you don't need to have symptoms at the time to be contagious. So there's an incubation period for the virus, and there's also a period after the infection where you're still shedding the virus, so that you can spread the virus to other people but without having overt flu at the time.
I had my flu vaccination. I'm probably like many people. I think, going to have a needle. So I went along and had a lovely nurse who actually made me feel really at ease. I filled out the form and I had a jab in my right arm. I was a little bit worried that maybe I'd feel a little bit unwell later in the day. I didn't. I was aware that I'd had a small injection and I had a little bit of local soreness in my arm, but other than that I wouldn't have noticed that I've had it. And what is really, really important is I know now that I'm safe for the rest of the year.
You can build up immunity to the flu, but only to the cases you've been exposed to. And because there are different types of flu every year, you're going to have resistance to a past version of the flu, but not the current version. If you don't have the flu vaccine and you are carrying the flu and you give it to your patients, I don't think that's an appropriate thing for a health worker to do.
Please have an influenza vaccine. It will protect you, it will protect your family, and it will protect our patients.